The killer cough from China has jumped borders. Children around the world have started falling sick. It's scary because it is hard to put a finger on what really is triggering the cough. Some experts believe it's a combination of different illnesses. Some are pointing at a mysterious pneumonia, some at white lung syndrome, even mycoplasma pneumonia and walking pneumonia. These are different names with similar symptoms. I'm talking about cough, fever and fatigue. Children as young as 3 are falling sick. Just have a look at what's happening in the United States. At least 142 children have fallen sick in just one county in Ohio. The average age of the patients is 8. Most of them tested positive for mycoplasma pneumonia. What is this? It's a lung infection caused by a bacteria. 142 is an unusually high number for a lung infection. What's more, in Ohio, it qualifies to be termed as an outbreak. The American state has launched an investigation. It is trying to find out what exactly is triggering this wave of illness. Is it a Chinese export? For weeks now, we've been telling you that something is not right in China. Consider this. In just one Beijing hospital, there are at least 7,000 hospitalized children. At least that's what reports are claiming. In cities like Xi'an as well, hospitals are crowded. We have been showing you videos of children doing their homework while receiving IV. We've also been getting you voices from on the ground of parents who are extremely worried. Many of them believe China is covering up something big, perhaps another outbreak. We have been constantly reminding you that the Wuhan virus also started as a mysterious pneumonia. The current infection has spread to several Chinese cities, by the way. China claims there is no novel virus. Instead, the illnesses are being triggered by a mix of known viruses. China is also pointing at a seasonal surge. In other words, Beijing wants you to believe that what's happening is normal. Why is that? Because people fall sick during the cold season. But here's the problem. Numbers are not adding up. In the Netherlands, there is a spike in pediatric cases. Between November 13 and 19, there were 103 pneumonia cases for every 100,000 children between the ages of 5 and 14. The week before, the number was 83. Last year, during the peak of the flu season, the Netherlands had just 58 cases of pneumonia for every 100,000 children. That number has almost doubled as we speak. How do we explain this data? Here's one explanation. Whatever is infecting babies in China has jumped borders. In Taiwan, people, especially the elderly and the young, have been asked to avoid travel to China. Back in the United States, Massachusetts is seeing a rise in illness among children. Doctors say it could be RSV. What's that, you ask? Respiratory syncytial virus. This virus is adding to the rising number of walking pneumonia cases, which is a term for a milder form of pneumonia. The symptoms again are sneezing, runny nose, sore throat and wheezing. In Denmark, at least 541 cases of mycoplasma pneumonia were reported last week. The cases have tripled since October. Mycoplasma pneumonia causes inflammation in the lungs, and Denmark State Serum Institute has issued a statement warning of a spike in cases of mycoplasma pneumonia. Listen to what SSI has also said. It said the infections in Denmark were high enough to be classified as an epidemic. Experts, in fact, pointed at how the numbers were significantly more than normal. And what explains that? Is it China? Every minute, there are flights going in and coming out of China, remember. We are currently in the holiday season. Tourists from China are traveling around the world. Tourists from around the world are traveling to China. And what's more, Beijing is counting on tourist dollars this year. The citizens of France, Germany, Italy, Malaysia, the Netherlands have been allowed to travel to China visa-free. In India, several states are on alert. In the national capital, New Delhi, a high-level meeting was held. A team of doctors and experts discussed the distressing news coming out of China. The team also took stock of the preparedness here in Delhi. Experts saying in order to stay safe, one must wash their hands, cover their mouth when coughing, stay home when ill, and stay up to date with vaccines. WION now available in your country. Download the app now. Get all the updates on the move.